Hi, Dr. Rezadeh again. I'm with one of my favorite patients here who's a 73-year-old who we've known now for a while regarding her back and leg symptoms. I'd love her to tell you her story, and we'll go through her scans as well as her progress with therapy. So
yes, it's been a long time and longest story. It started my lower back pain 10 years ago and causing problem on my legs and my lower back, and I go through therapy. I see few different doctors, and then they are telling me go through surgery because there is some damage on my spine cord and then some other problem, and disc is out and all those problems. So I started physical therapy. I started some exercise. I started yoga, which I used to do it even 20 years ago. I started yoga more times a week, and then finally we end up to last October on 2018 or 17, that I had a very back pain, very lower back pain. I couldn't properly walk. I fall down 2 times. I slid out of the steps, and that was very, very bad. And my doctor referred me to a surgeon. I go see the surgeon, told me, you got to go through surgery. No other way that you're going to be good. So I didn't agree with that. I go home and research, and that doctor doesn't have very high score. So anyhow, my own doctor told me, my family doctor told me, SpineZone, there are new clinic, they're a specialist on the back pain and spinal cord. If you want me to refer you to that doctor and surgeon and the clinic, go and find out how you can get a strength back. So I went to the line and I find it, and I set up appointment, and I saw Dr. Rezadeh, and then I started physical therapy.
So this is a wonderful, because at the time when I saw her, this was now last year, her pain level was around an 8 out of 10, very severe. And I want to show you her films, because this is what is so remarkable about how severe her condition was. Now these are the patient's films. This is a cross section going through the L4-5 level. And you can see how these discs are degenerated, and you can see how the spinal canal, which is usually supposed to be a big tube like this, starts to get narrowed at multiple levels here. And you can see how there's like an hourglass compression, especially here and here. Now, if you look at the cross section through this L4-5 level, that's what you're seeing on this side. The spinal canal is so narrowed, it's very narrowed into this little tiny space, and there's all of this compression from ligaments and the disc bulging. And watch what happens when we go disc levels up. So when we come up to the next disc level, which is L2-3, again, you see the L3-4, you see the spinal canal is very narrowed also. And there's a disc herniation also pressing from the front, compressing on the nerves. And you can see how severe those are. Now compare that to a normal level, which up here, you see on a normal level, like a cross section through this top portion, you see that the disc is here and the spinal canal is here, and it's wide open. So again, this is an example of just how tight her stenosis was, and that's what was causing her very severe leg pain. As you can see, her X-ray shows a degenerative scoliotic curve. You see how it curves fractionally down in the lower lumbosacral spine this direction, and then comes over about a 23-degree curve going the other direction. And on her side view, she's got a lot of flattening of the normal normal lumbar lordosis or curvature of the back. So she was quite tight as far as her spinal canal being stenotic, but also having degenerative scoliosis and degenerative disc disease and disc herniations at multiple levels. So then what happened that was different at SpineZone compared to the other physical therapy that you had and everything that didn't work in the past? What happened to SpineZone that turned things around?
SpineZone, that was a very good clinic that I registered there, and I started since November till now. And their therapists there, they're very friendly, very knowledgeable for what they're doing and explaining everything before we start doing exercise. And very cooperative, and I did it twice a week, and I was so happy. I feel like as they're my family. Even they moved from that clinic to other clinic, I feel sad, and I said, oh, I lost one of my son or my family. But thanks to God and thanks to them that I feel better now.
And you used the machines that strengthened
yes,
your back.
yes.
Was that very different than anything else you'd experienced?
Yeah, the machine were very good. They may find it in any other gym, but I don't know how to use them, how to do it that benefit me. So I don't use them at all, but I use all the machine in the clinic, and they show me how to use them. And it's very important not put it very low, not to put it very high. And they were showing me how to do exercise, and they were all around and check everything all the time.
So now you are about 10 months after that.
Yes.
And still you've had sustained improvement, and your
Yes.
pain's completely gone away in your
Yes,
legs
yes.
and in your back. So the key thing for you that I want everybody to
Yeah.
understand is how motivated she was. She, despite other therapists, despite failing other types of therapy, she had the motivation to continue this, finish it, and really get her strength up to par. And when her strength came up, that's when everything improved.
Yes, the motivation was the people, therapists, and first the Dr. Rezide, that very friendly and explain everything to me. I want to get my strength back. That's my goal. And keep asking me, what is your goal? We're going to help you to get to your goal. That I got to my goal, thanks to everybody, thanks to God, that I'm strength back, and I can walk properly. I can walk. I'm not like as before, like as I was younger, but I can walk for a long way. And while talking with the therapist, talking with Dr. Rezde, maybe I can start my yoga again.
Absolutely. And the key thing is maintenance, keeping
Yes.
you on this,
Yes.
to keep this never bothering you again.
Sure.
Thank you so much for doing
Thank
this
you
for all the
so
rest of the
much,
patients.
Dr. Rezde.
Absolutely.
Good
Thank you.
luck.
Thank you.